Good evening, everybody. I see Mila, Bushanette, Barad, a couple different viewers here. Thank you guys for attending. Tonight we will be going over the CNA and PCT trivia night. So you guys get ready for a night of trivia and we'll go ahead and get started. And again, I'm glad to see you all here with me. So welcome to our trivia night. This is for CNAs and patient care techs. And whether you're a student, new grad, or healthcare professional, this is for you. So this is for everyone. Get ready to test your skills and challenge your knowledge, and let's have some fun. Hello, everybody. I see Naomi's back, Miranda, Danita, Shakaya. All right, next slide here. This is brought to you by Florida Training Academy, where we're empowering caregivers, changing lives. So grab a pen, keep score, and don't forget to comment your answers below. And also don't forget to like, share, and subscribe for more videos. So question number 1. While assisting a resident during lunch, you notice them frequently clearing their throat and coughing after swallowing. What's your next best option? Option A is notify the nurse immediately. Option B is encourage them to eat slowly. C is offer a drink of water. Or D is perform abdominal thrusts. Give you guys a few seconds here. I hope everybody's week has started off great. I'm having a good Monday. Here we go in 3, 2, and 1. Correct answer is C, or A, I'm sorry. Notify the nurse immediately. The rationale, repeated coughing after swallowing may indicate aspiration risk. The nurse should assess before continue feeding. So we don't want them to aspirate. So when you aspirate, you get foreign particles in the lungs, which can cause pneumonia. So we want to notify the nurse immediately so they can get further evaluated. All right, question 2. A patient suddenly becomes confused and agitated during a routine bed bath. What is your first response? A. Restrain the patient to keep them safe. B. Pause the bath and speak calmly to the patient. C. Quickly complete the bed bath to avoid distress. Or D. Call for another CNA to assist you. Pass my test. Congratulations. I'm so proud of you. All right, here we go, you guys. In 3, 2, and 1. Correct answer is going to be B. Pause the bath and speak calmly to the patient. So sudden confusion could be a sign of delirium or discomfort. Calming the patient helps assist and de-escalate the situation. Who passed their test? Up in the comments is, let's see, Jesus is King was their name, I believe. Commented that they passed their test. So congratulations there. Question number 3. Which of the following statements best reflects the CNA's role when sterile technique is required during a procedure? A. The CNA may assist by applying sterile gloves and preparing the sterile field. B. The CNA is responsible for maintaining the sterility of instruments during the procedure. C. The CNA observes the sterile procedure and reports any break in technique to the nurse. Or D. The CNA performs the sterile procedure as directed by the nurse. What are we thinking here? So we are thinking about our scope of practice. And one thing we do not do is work out of our scope of practice. So think about that whenever you're thinking about your option choices. All right, in 5, 4, 3, 2, 1. The correct answer is C. Great job, you all. The CNA observes the sterile procedure and reports any breaks in technique to the nurse. CNAs do not perform sterile procedures but can assist by observing and reporting any concerns. Maintaining sterility is the responsibility of licensed personnel. Question 4. A patient on fall precautions is trying to get out of bed unassisted. What should you do first? A, stay with the patient, assist them safely. B, activate the bed alarm. C, tell the patient that they must wait for help. Or D, go get the nurse immediately. Naya, your test is Thursday. I'm wishing you the best. I know you're going to do great and you're going to pass. So definitely study hard, work hard. You'll do great. All right, in 3, 2, and 1. Correct answer is A, stay with the patient and assist them safely. Patient safety comes first. Always, you guys know safety is always first. Never leave a fall risk patient unattended. Help them safely and then notify the nurse. Let's say that we did decide to leave the patient to go notify the nurse without making sure that the patient was safe. If they fell and they hit a certain level, they could become unconscious. They could get a fracture, if they fell and hit their hip, things like that. So we want to make sure that we are getting them to where they are seated safely and then notifying the nurse. All right, question 5. A patient care tech is checking a telemetry monitor and notices an irregular heart rhythm. What is the most appropriate next step? A, silence the alarm and continue rounds. B, note the time and monitor for trends. C, report it to the nurse without delay. Or D, print out the rhythm strip and file it. Let's see. All right. In 5, 4, 3, 2, and 1. The correct answer is C, report it to the nurse without delay. An irregular rhythm could signal a cardiac event. Immediate communication with the nurse is vital. And then also, you guys, here's a reference. So for online patient care tech classes that include EKG and phlebotomy training, visit www.floridacareeracademy.com. Question 6. A CNA notices that a patient's urinary catheter bag is positioned above the level of the bladder. What is the best action to take? A, clamp the tubing to prevent backflow. B, disconnect the bag from the catheter. C, disconnect and reposition the tubing. Or D, lower the bag below the level of the bladder. All right, in 3, 2, and 1. Correct answer is D, lower the bag below the bladder level. The rationale, the drainage bag must always be kept below the bladder to prevent backflow, which can lead to infection. So basically what that means is if the urinary catheter bag is above the bladder, that urine will go back into the bladder, and then you can have the concentrated urine, which it can be causing an infection, and the patient can get a urinary tract infection. So we want to make sure that it's below the level of bladder so that it's pulling down with gravity and we're not bringing something that already went out of the bladder back in. Peter, I hope that you have safe travels, and yes, you can come back and watch the video later. Thank you. All right, question number 7. When providing oral care to an unconscious patient, which is the safest position to place them in? A, prone. B, supine. C, high Fowlers. Or D, side lying. Good job, you guys. Here we go in 3, 2, and 1. Hello, Laura. The correct answer is D, side lying. So positioning an unconscious patient on their side helps prevent aspiration during oral care. So as you guys see, their head is tilted to the side. That way the fluid is not going down into the throat, it's going out on the side of the mouth. All right, question number 8. A patient care tech is asked to obtain a blood glucose level before lunch. Which of the following is the most important to do first? A. Wipe off the first drop of blood. B. Use the same lancet for multiple patients. C. Shake the glucometer strip. Or D. Skip hand hygiene and gloves are worn. Give you guys a few seconds here. Some of these answer choices made me panic. I was like, oh no, never, ever, ever, ever. All right, here we go in 3, 2, and 1. The correct answer is A. Wipe off the first drop of blood. The first drop may contain tissue fluid, so wiping it off ensures a more accurate glucose reading. And you guys know we never ever share needles. Sharing needles can lead to bloodborne pathogens, which could give us infections. So we never share needles and we never recap needles. All right, question number 9. You enter a room and notice that a tracheostomy patient is having difficulty breathing and their oxygen saturation is dropping. What is your first action? A. Suction the trach immediately. B. Remove the trach tube. C. Call for help and stay with the patient. Or D. Increase oxygen to 15 liters. All right, in 3, 2, and 1. Correct answer C. Great job in the comments section. Call for help and stay with the patient. CNAs and PCTs do not perform suction or adjust oxygen. Stay with the patient and alert the nurse or respiratory therapist immediately. Did you guys know that oxygen is considered a medication? If you didn't, add that to your notebook because CNAs are not allowed to administer medication and oxygen is a medication. What happens if you shake the glucometer? Whenever you're checking for a blood glucose level, you want to make sure that it's on a flat surface. If the device is on a movable surface, it may interfere with results, so be sure that it's on a flat surface. Question 10. A CNA is reviewing the stages of pressure sores during an in-service training. Which of the following correctly describes a stage 3 pressure ulcer? A reddened area that does not blanch when pressed with no skin break. B, a shallow open sore with a pink wound bed and partial thickness skin loss. C, a deep wound with full thickness skin loss and visible fat tissue. Or D, a dark necrotic area with full thickness tissue loss and visible bone. So they're wanting to know what describes a stage 3 pressure ulcer. So always remember, look at your question, think about what your question is asking you, and then choose the best answer. All right. A few more seconds here in 3, 2, and 1. The correct answer is C. Great job, you guys. A deep wound with full thickness skin loss and visible fat tissue. So the rationale, stage 3 pressure ulcers involve full thickness skin loss where fat may be visible, but muscle, bone, or tendon are not exposed. Stage 1 is redness without a skin break. Stage 2 shows partial thickness loss with exposed dermis like a blister or shallow open sore. Stage 4 or stage 3 is in the rationale. It involves a full thickness skin loss where fat may be visible but muscle, bone, or tendon are not exposed. And stage 4 includes full thickness tissue loss with exposed bone, tendon, or muscle. Great job there, you guys. I see something in the comments. I'm going back up, trying to find it. Thank you for the videos. You guys are welcome. Somebody else passed their boards. Laura, I passed my board test last week. Your videos helped me a lot. Congratulations. I'm very happy to have you here, and I'm also happy to hear your good news. All right, question 11. A patient tells the CNA, I do not want to take a bath today. I am too tired. What is the most appropriate response? A, let's get it over with quickly. B, you must bathe now to prevent infections. C, if you refuse, I'll have to document noncompliance. Or D, okay, I'll come back later when you feel more rested. Hello from Texas, Yoselin. You guys are all over. I appreciate you guys tuning in. All right, here we go in 3, 2, and 1. Correct answer is D. Okay, I'll come back later when you feel more rested. The rationale, respecting the patient's right to refuse care and offering to return later, is supportive and promotes autonomy. Don't forget to document the patient's refusal. Yes, yes, and yes to that. So make sure if you guys are documenting the refusal, because the patient may need a change in their plan of care. Like, for example, you may notice that they don't like their showers or getting cares done in the evening, but they're more compliant with it during the day. So the nurse and the care plan manager will come up with a plan, as well as with the CNA and the team as the patient, to try to make things easier on the patient. So always want to promote autonomy. Question 12. A patient care tech is weighing a patient who is scheduled for dialysis at noon. When should the weight be taken? A, after lunch, B, at bedtime, C, before breakfast, or D, before dialysis? So last week we talked a little bit about dialysis. There was a picture in there. If you guys remember that, just kind of putting things together in perspective for you. All right, there we go in 3, 2, and 1. The correct answer is D, before dialysis. So, dialysis patients are weighed before and after treatment to monitor fluid removal and excess fluid retention. The pre-dialysis weight, also called the present weight, helps determine how much fluid needs to be removed during dialysis. Waiting until after meals or at bedtime will not give an accurate baseline. So we want to make sure we have a good baseline. You guys, that was a difficult question, but you guys did very well. And remember, even if you don't know the answer, don't skip the answer, still choose the answer, because that gives you more of a chance of getting your percentage higher passing. Question 13. Which of the following best protects a CNA from injury when transferring a heavy patient? A, lifting with your back. B, twisting your waist during the transfer. C, using a gait belt and proper body mechanics. Or D, keeping your feet close together. So one thing that I did whenever I would take tests, if I could like act something out, I would be doing it in my head. So I'm thinking right now, if I'm lifting with my back, what would that look like? If I'm twisting my waist during the transfer, what would that look like? Using a gait belt and proper body mechanics, what would that look like? And then keeping my feet close together while I'm trying to transfer, what would that look like? So I just kind of do that as a process of elimination. How do they grade the CNA exam? It's a pass or fail exam with those. And then if you guys need any clarification on anything that I'm not giving you a answer that you like or that you need more detail with, I recommend you guys emailing admin and it's capital FL, then lowercase training.com, and they can reach out to you as well to answer that question. But it is a pass or fail exam. All right, here we go. Correct answer C. Good job. Using a gait belt and proper body mechanics. So the gait belt provides stability, and proper body mechanics help prevent caregiver injuries. So be sure, we only have one back in this, we're helping people move. We're literally putting other people's weight onto our body. So be sure that you guys are always using proper body mechanics. Even if it's just picking up something you dropped off the floor or anything like that, make sure you're using proper body mechanics and save your back. Question 14. A CNA is caring for a confused patient who keeps trying to pull out their IV. What is the best response? A. Apply wrist restraints immediately. B. Reorient the patient and notify the nurse. C. Remove the IV. Or D. Ignore the behavior unless they succeed. A few more seconds to answer here. I'm seeing some new people in the comments that I haven't seen before, so thank you guys for joining us in. All right. 3, 2, and 1. The correct answer is B. You guys are so smart, and I knew you would get this one right. Reorient the patient and notify the nurse. The rationale is that reorientation and communication with the nurse are essential. CNAs cannot remove IVs or apply restraints without orders. Question 15. During hourly rounding, a CNA observes the patient's Foley catheter tubing is looped and has no output for several hours. What should the CNA do? A. Straighten the tubing. B. Irrigate the catheter with saline. C. Remove the catheter and call the nurse. Or D. Increase the patient's fluid intake. Jackie, yes, the CNA exam is a pass or fail. I know in where I live, you can take it more than once if you don't pass it the first time. But yes, double check and send that to admin@fltraining.com. But I know it is a pass or fail exam, but I don't know how many times you all can take it. And you also can go visit your state board of nursing website, and that will give you more information on that as well, because sometimes guidelines vary from state to state. Where I am, we do have it doesn't really say a percentage, but it'll say if you pass or fail on there, but then it would give us like a breakdown of which ones you would need more work on. But they say you have 3 times to pass it there. All right, here we go. A. Straighten the tubing. Tubing loops can obstruct flow. Straightening and reporting the changes is appropriate and within the CNA's role. All right, question 16. 1 ounce is equivalent to A. 10 milliliters, B. 15 milliliters, C. 30 milliliters, or D. 45 milliliters. I seen someone ask about the so when we do we create the slides on our own? Yes, we create all of our slides, and all this is all content from Florida training. All right, in 3, 2, and 1. C, 30 milliliters. So 1 ounce is equivalent to 30 milliliters or 30 cc's, which is cubic centimeters. So guys, remember your conversions, because if you have to do math, or let's say a patient says they want a 2-ounce drink and somebody may say, what is that in milliliters? You want to know. 1 ounce is equivalent to 30 milliliters or 30 cubic centimeters. So milliliters and cubic centimeters are equivalent, 1-to-1 ratio. Thank you, Myla. All right, question 17. A patient tells you that they are feeling lightheaded after standing up. What is the best response? A, encourage them to keep walking. B, sit them down and lower their head. C, call the lab for a stat blood draw. Or D, offer them a cup of coffee. Barat, I see you say good morning. It must be morning in your time zone. Good afternoon from Illinois. All right, in 3, 2, and 1. The correct answer is B, sit them down and lower their head. So this is an example of supine position. So this helps prevent a fall and helps promote blood flow to the brain. So we always want to ensure safety first. So below the picture it says wait for the nurse before placing the patient in the Trendelenburg position. So laying on your spine is supine. So one way that I was able to remember supine, if you take the U out of it, so it's spelled Supine. If you take the U out, then you have a spine there. So supine, spine. And then in the picture is showing the Trendelenburg position. So Trendelenburg is whenever the feet are higher than the head, and this helps promote blood flow. So always wait for the nurse before you put them into that position, but you can get them laying on their spine. All right, question 18. A CNA is assisting a patient with a bedpan when the fire alarm sounds. What is the most appropriate action? A, leave the patient and immediately evacuate the area. B, remove the bedpan quickly and leave the patient alone. C, stay calm, ensure the patient is safe, and then check the location of other patients. Or D, yell for someone else to evacuate the patient. Esther says only by doctor's order. So Esther, you are able to put a patient into a certain position without an order, unless it's the doctor says not to do that. But you can position a patient that is within you all scope of practice. So you may not know, like right now, if I walk up to you and I get really dizzy, you may just tell me to sit down, and then you have me lay flat. The nurse comes in, and then you're putting me in that Trendelenburg position. So positioning is within you all scope of practice as a CNA or PCT. All right, I'm going to reveal the answer in 5, 4, 3, 2, and 1. Correct answer is C. Stay calm and ensure the patient is safe, and then check the location of other patients. So during a fire alarm, the CNA's first priority is patient safety. The patient should never be left in a vulnerable position, such as on a bedpan. Once the patient is safe and secure, the CNA can follow the facility protocol, which may include checking other patients for potential evacuation, depending on the fire's location. Panic or abandoning patients is never appropriate. So you guys know when we stepped into this field of healthcare, we are there to protect the patients. We are there to be an advocate for a patient. And in the case of an emergency, we are there to help them evacuate and to get to safety. So safety is always first. Question 19. Which of the following is a sign that a patient with a urinary catheter may have a urinary tract infection? So UTI, urinary tract infection, guys. A, complaints of burning and foul smelling urine. B, no urine in the bag after 1 hour. C, clear yellow urine. Or D, increased appetite. So what's the question asking? It's asking, we're looking for signs of a UTI. All right, in 3, 2, and 1. Correct answer is A. Excellent job in the comment section. I think all of you got that correct. Complaints of burning and foul smelling urine. So these are classic signs of urinary tract infections and should be reported to the nurse promptly. Question 20. When transferring a patient from bed to wheelchair, which action ensures safety? A. Unlocking the wheelchair for easy movement. B. Making sure the wheelchair brakes are locked. C. Placing the wheelchair behind the patient. Or D. Lifting the patient under their arms. I'll reveal the answer in about 3 seconds. So 3, 2, and 1. Well, Hold on. My computer froze. Sorry, guys. Let's see. We were on. Give me just 1 second. Sorry about that. There we go. Sorry about that, you all. So question 20 is B, making sure the wheelchair brakes are locked. Locked brakes prevent the chair from sliding, which is essential for safe transfer. So before I've taught CNAs and we were doing our skills testing. And one thing that would make you fail the skill is if you transfer without locking that wheelchair, because that is a big safety precaution. You want to make sure that the wheels are locked, because if the wheels aren't locked and that patient starts to go into that wheelchair can move and they can fall and they can cause themselves a lot of harm. So be sure that that wheelchair is locked before you transfer a patient. Question 21. A patient care tech working in a hospital is assigned to collect a 24-hour urine specimen. What instructions should be given to the patient? A, you can stop once the container is half full. B, you don't need to refrigerate the sample. C, save your first urine in the container. Or D, discard your first void and collect all others. A few more seconds here. This is a tough one, especially if you've never had experienced this before. 3, 2, and 1. The correct answer is D. Discard your first urine and collect all others. So in a 24-hour urine collection, the first void of the day is discarded because it represents urine that was produced before the 24-hour period began. This void sets the start time for the collection. From that point on, every drop of urine must be collected for the next 24 hours, including the final void at the same time the next day. The collected urine is typically stored in a designated container and kept on ice or refrigerated to preserve its contents for accurate lab analysis. So, first, this is a lot of information about the 24-hour urine collection, but we want to make sure that we're doing it right. So we want them to void first, and then after that, that's the start time. Question 22. A CNA walks into a patient's room and finds the patient unresponsive and not breathing. What is the immediate action? A, perform a sternal rub. B, begin chest compressions. C, call for help and initiate CPR if allowed per policy. Or D, shake the patient harder. So break this question down. All right, here we go in 3, 2, and 1. Correct answer is C. Call for help and initiate CPR if allowed per policy. If a patient is found unresponsive, the CNA should first call for help and then begin CPR, only if the patient is not designated as a DNR, which is do not resuscitate, and facility policy allows. CNAs who are certified in CPR and whose scope of practice permits may initiate chest compressions while awaiting the emergency team. However, if the patient has a valid DNR order, the CPR should not be started and the situation must be reported to the nurse or supervisor immediately. So, with the code status, most people are either a full code or a DNR. If they're a DNR, that means they do not want resuscitated. They've made this decision and their family has made this decision that they do not want that. So please be sure that you guys are aware of your patient's code status. Whenever you're giving a report, be sure to pass that off to the oncoming staff so that everyone knows. But yes, if they're not breathing, they don't have a pulse, and they're unconscious, those are the three things that would contribute to CPR. And make sure that you guys are certified and allowed per policy. All right, question 23. A CNA is documenting the output from a patient's JP drain. Which unit of measurement should be used? A, milliliters, B, ounces, C, pounds, or D, grams? When you guys answer this, somebody else tell me what a JP drain is. What does that stand for, if anybody knows? If not, don't feel bad. Jot it down so you know next time. Any takers in the comment section? All right. In 3, 2, I'm trying to hold off to see if anybody knows what JP stands for. And 1. The correct answer is A, milliliters. Good job on that part. Liquid output is always recorded in milliliters to ensure accurate training. So you guys, JP stands for Jackson Pratt. So if anybody asks you, yep, there you go, Tanika. Is it Tonica? Good job. Carmina, yes, good job. Jackson Pratt. So if you see a patient and they give you a report, they say they have a JP draining from the left side, then you know, oh, that's a Jackson Pratt. So with the Jackson Pratt, we just squeeze it to make like a vacuum, and then it's going to pull the fluid out. It's supposed to be empty so many different times a day, and you record that into the patient's output. But yes, Jackson Pratt, great job, you guys. Question 24. A patient care tech is instructed to take orthostatic vital signs. What is the correct sequence? A, lying, sitting, standing. B, standing, walking, running. C, sitting, lying, standing. Or D, lying, walking, standing. Is that the thing the patients have whenever they have stomach obstruction? Mila, sometimes they may have a Jackson Pratt. It all depends on the surgeon, whatever kind of drain system that the surgeon prefers. But sometimes you may see that they have one with a stomach surgery. I've also seen them in breast reductions. I've seen them whenever people have gallbladder taken out. A lot of different things I've seen them, but it depends on how the surgeon wants to close that up. All right, correct answer in 3, 2, and 1. Correct answer is A, lying, sitting, standing. So orthostatic vitals are measured to start from lying down to identify any significant drops in blood pressure as the patient changes positions. So lying, first they're lying down, then they're going to sit up, and then they're going to stand. That's orthostatic vitals. Question 25. During AM care, a resident becomes tearful and says, "No one cares about me anymore." What is the best response by the CNA? A, that's not true. Cheer up. B, you should talk to your doctor about this. C, tell me more about how you're feeling. Or D, I'll let your roommate know that you're upset. I'm going to reveal the answer in 3, 2, and 1. The correct answer is C, tell me more about how you're feeling. So this response shows empathy and open communication, allowing the resident to express their feelings. So this gives them more of a chance to express their feelings. So it's not shutting down the communication. It's actually opening it up to get more out of the resident so we can try to help them more so we know what's going on. A CNA is measuring a patient's fluid intake. The patient drank an 8-ounce cup of juice and a 4-ounce carton of milk. What is the total intake in milliliters? You guys, it's time for some math. So you guys know lots of math in this field. So we're doing a conversion now. We want to know what is the intake in total milliliters. So this is another thing. Whenever I have questions like this, I go to the very end. What is this question asking? So it's important that you guys know that the question is asked in ounces, or it's presented in ounces, but the question is wanting a response in milliliters. So what is the total intake in milliliters? In 3, 2, and 1. Correct answer is B, 360. So the way that we got that, 1 ounce equals 30 milliliters. So we have 8 ounces plus 4 ounces equals 12 ounces, right? So then we're going to take the 12 ounces, and now we're doing our conversion because 1 ounce equals 30 milliliters. So 12 times 30 is 360, and that's how we got that answer. Great job, guys. All right, question 27. You are instructed to assist a patient with limited mobility to reposition every 2 hours. What is the primary purpose of this task? A, to prevent constipation. B, to reduce snoring. C, to prevent pressure injuries. Or D, to help the patient fall asleep. Remember, I think on the first video I had with you all, it only takes 2 hours for something to happen. I almost gave you the answer. I'm sorry. In 3, 2, and 1. To prevent pressure injuries, it only takes 2 hours for a pressure injury to present itself, and they are very difficult to treat. So be sure that you guys are repositioning the patients often, because regular repositioning prevents skin breakdown by relieving pressure on those bony areas. Question 28. A CNA is giving perineal care to an uncircumcised male patient. What is the correct method for cleaning the penis? A, retract the foreskin, clean the area, and then return the foreskin to its normal position, gently cleaning the penis without pulling back the foreskin. B, retract the foreskin, clean the head of the penis, and leave the foreskin retracted. C, gently clean the penis without pulling back the foreskin. Or D, avoid cleaning under the foreskin unless the patient requests it. In 3, 2, and 1. Let's reveal the answer. There we go. The correct answer is B. Retract the foreskin, clean the area, and then return the foreskin to its normal position. So what the rationale is saying, for uncircumcised male patients, the foreskin must be gently retracted to clean underneath, as this area can collect bacteria and debris. I think that's smegma. Yes, smegma, sorry. Bacteria and debris. After cleaning, it's critical to return the foreskin to its normal position to prevent circulatory issues or swelling. So that's paraphimosis. All right. So be sure to retract the foreskin to make sure we're getting clean period care going. Question 29. A CNA enters a room and sees a family member adjusting a patient's oxygen setting. We know oxygen is a medication. Can family members give medication in the healthcare setting? What is the best response? A, thank them for helping. B, adjust it again to the original setting. C, ignore it if the patient looks okay. Or D, notify the nurse immediately. Give you guys a few seconds here because I know you guys are so smart and you're going to get the answer right off the bat. In 3, there go my smart people. Good job, you guys. 2, and 1. Correct answer is D. Notify the nurse immediately. Oxygen adjustments must be performed by licensed personnel only. The nurse must be notified of any unauthorized changes. So great job, you guys. Question 30. A resident begins yelling at staff and banging on the table. What is your best initial response? A, call security. B, yell back to establish control. C, remain calm and ask what's wrong. Or D, leave the room and return later. Getting a lot of answers in the chat there, which is great. 5, 4, 3, 2, and 1. Let's reveal the answer. The correct answer is C. Remain calm and ask what's wrong. Remaining calm helps de-escalate the situation. Assessing their needs shows compassion and professionalism. You guys know where they say two wrongs doesn't make it right. Yelling at a resident will never get you anywhere besides probably road up. So make sure that you guys are being compassionate, you're being understanding, and we always want to de-escalate the situation. There are online patient care tech classes. To get more information, you guys can call our advisors at 877-225-7151. And these are, the classes are offered nationwide. So anybody, any state can get in on this. And then also you guys can visit www.floridacareeracademy.com for the online PCT classes. Question 31. Which of the following situations should a CNA not use a rectal thermometer? A, if the patient's unconscious. B, if the patient has diarrhea. C, the patient's hypothermic. Or D, the patient's middle age. And for an extra bonus point in there, you guys tell me the color of a rectal thermometer. Going to reveal the answer. So it says, ooh. We are definitely thinking now, aren't we? Because I want you guys to put things into perspective. I want you to know what to do whenever you're out there in the field. Yes, red. And always think, because this is the way my brain works, red, rectal, 2 R's. So that's how we get that one. Correct answer is B. The patient has diarrhea. Rectal temperatures are not taken in patients with diarrhea due to the risk of mucosal irritation or injury. Great job on both of those, you guys. All right. Question 32. A patient care tech is helping a patient with a fractured hip move up in bed. What is the best tool to use? A, a slide sheet. B, a stretcher. C, a pillow. Or D, a wheelchair. You guys a few seconds to answer this as well. In 3, 2, and 1. The correct answer is A, a slide sheet. A slide sheet reduces friction and prevents further injury when repositioned in mobile or orthopedic patients. So definitely use your slide sheet and be sure that you have one person on one side and another person on the other side, because you don't want to try and move that slide sheet by yourself, because you will injure your back. It may not be that day, but eventually in the future, you're putting the patient at risk and you're also putting yourself at risk. And remember, patient safety is the number one. Question 33. Which of the following should the CNA report to the nurse? A blood pressure reading of 118/76. And you guys, the mmHg, that stands for millimeters of mercury. B, a respiratory rate of 21 beats per minute. C, pulse of 56 beats. I said respiratory rates of 21 per minute. Sorry, that's breaths per minute. B, a pulse of 56 beats per minute. Or D, a temperature at 98.6 degrees Fahrenheit. All right, correct answer in 3, 2, and 1. The correct answer is C, 56, the pulse of 56 beats per minute. So a normal adult pulse, ranges from 60 to 100 beats per minute. A pulse of 56 is considered bradycardia, which, remember we said Brady means slow, and which may be normal for athletes, but should still be reported to the nurse for evaluation. Other vital signs listed are within normal limits. So definitely knowing your normal values will get you far. Question 34. A CNA is providing catheter care to a male patient with an indwelling catheter. Which action is correct? A. Hold the catheter near the tip and clean towards the meatus. B. Clean the urinary opening down the catheter tubing. C. Avoid touching the catheter while cleaning the penis. Or D. Gently tug the catheter to make sure it's secure before cleaning. Give you guys a few seconds to answer that. In 5, 4, 3, 2, and 1. The correct answer is B. Clean from the urinary opening down the catheter tubing. When providing catheter care, it's essential to hold the catheter near the meatus to prevent pulling and clean away from the body, starting at the urinary opening and moving down the tubing. This prevents bacteria from being introduced into the urinary tract. Never tug or reposition the catheter without a nurse's instruction. Let's see, I see some things in the comments here. We never tug at the catheter as it can cause discomfort and even cause the catheter to disconnect. That is very true. Good job, Mila. All right, guys, on to the next one. Question 35. A CNA walks into a room and notices that a patient is tearful. What should the CNA not do? A. Remain quiet. B. Ask the patient, why are you crying? C. Ask the nurse for help. Or D. Offer tissues. You guys 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is B. Ask the patient, why are you crying? So I know this sounds like something that you would do, you know, like you ask people, why'd you do this, or why'd you do that, or why did that make you upset? But when we learn our therapeutic communication techniques, saying why could cause the patient to feel defensive or unheard. Refrain from asking why and choose other therapeutic communication techniques. So if you guys want, I suggest you write that down, because that is a part of therapeutic communication. We don't ask why. There's another way to word a question without asking why, because people may feel offended. Question 36. A patient recovering from abdominal surgery reports the urge to urinate, but is weak and has not yet been out of bed since the procedure. The patient is on fall precautions and has a urinary output goal listed in the care plan. What is the most appropriate action for the CNA to take? A. Bring a urinal or a bedpan and assist the patient while maintaining privacy and safety. B. Encourage the patient to get up and walk to the bathroom independently to promote mobility. C. Tell the patient to try holding it and check back later when the nurse is available. D. Immediately notify the nurse and wait for further instruction without attempting care. All right. I'm going to reveal the answer in 3, 2, and 1. The correct answer is A. Bring a urinal or bedpan and assist the patient while maintaining privacy and safety. Since the patient is post-op, which means that they came out of surgery recently, weak and on fall precautions, getting out of bed without proper assessment and support may be unsafe. CNAs are trained to provide toileting assistance using appropriate devices like bedpans or urinals, especially when mobility is limited. The CNA should also monitor output and report abnormalities. Encouraging independent ambulation or delaying care could lead to falls or complications. Yes, you guys, I agree. The question was tricky, but that's how they are. Like some answers are great, but you have to pick the best answer. So there's only one correct answer. There's good answers, but there's only one correct answer. All right, question 37. Which observation should a CNA report immediately during catheter care? A, light yellow urine. B, a drainage bag with a secure cap. C, the tubing loops once before entering the bag. Or D, urine with a foul smell and cloudy appearance. I'm going to give you guys about 3 seconds to answer this because I know that you guys know it. In 3, 2, and 1. The correct answer is D. Excellent job, you guys. Urine with a foul smell and cloudy appearance. So these are signs of infection and must be reported for prompt medical attention. Question 38. While ambulating a patient, they begin to fall. What is the best way to assist them safely? A, hold them up and try to stop the fall completely. B, step aside and allow them to fall to avoid injury to yourself. C, ease them to the floor while protecting their head. Or D, call for help and freeze in place. I'm going to give you guys the answer in 3, 2, and 1. The correct answer is C. Excellent job there. Ease them to the floor while protecting their head. Assisting a controlled fall minimizes injury both to the patient and the caregiver. So we don't want to try to lift them back up because we could cause injury there. We don't want to just move out the way because we are there to assist them. And then easing them to the floor while protecting their head. So I always say, if you're able, let's say a patient is falling in front of me and I'm coming behind them and I'm going to put one leg in between there. So if their legs are like this, my leg is going to be in between there, just one of them. And I'm going to try to take them down. So I'm going to bend at my knee and kind of make a slide with my leg for them to slide down so I can try to control that fall because, as you guys know, people are more at risk for fractures whenever they fall, so we don't want them to fall. And if they do, we want to assist them in falling, so we want to make it easier so that they're less likely to break something. Question 39. A patient care tech observes a new skin tear on a patient's forearm during repositioning. What should the PCT do? A, cover with the bandage and continue care. B, document the incident and alert the nurses. C, apply lotion and move on. Or D, tell the patient to not scratch next time. All right, I'm going to reveal the answer in 3, 2, and 1. The correct answer is B, document the incident and alert the nurse. Skin tear should be assessed by a nurse. We want to document and report it per facility policy. So definitely know what your facility policy is when it comes to incident reports or skin tears and things like that. Question 40. A resident politely refuses to have their morning vital signs taken. Which response by the CNA demonstrates the best approach? A, can you help me understand why you don't want to take them this morning? B, I'll let the nurse know so she can force you to comply. C, that's fine. I'll just skip your vitals for the day. D, you do not have a choice. This is part of your care. Give you guys just a few seconds to answer this. In 3, 2, and 1. The correct answer is A. Can you help me understand why you don't want to take them this morning? The rationale: residents have the right to refuse care, including vital signs. The CNA should remain calm, respectful, and attempt to understand the reason for the refusal while documenting and reporting it to the nurse. Open communication often helps resolve concerns and build trust. Forcing care or dismissing the refusal violates patients' rights and facility policy. So here the question isn't just saying, why don't you want them to take you? Why don't you want them taken this morning? The question asks a full span. Can you help me understand why? So, like I said earlier, don't just ask why. If we're getting more details with it like this one, can you help me understand why? That's engaging conversation, because yes, they do have a choice. Patients do have a right. Patients have a lot of rights, and we want to make sure that we aren't interfering with any of those. Question 41. What is the best way to identify a patient before providing care? A, ask them their room number. B, ask their name and social security number. C, call them by the name on the chart. Or D, ask for their name and date of birth and check the wristband. So here again, we're thinking about safety. So I'll reveal the answer in 3, 2, and 1. The correct answer is D. Ask for their name and date of birth and check the wristband. So confirming identity with 2 identifiers ensures the patient's safety and prevent errors. Good job, you guys. Question 42. While checking vital signs, a CNA records the pulse of 124 beats per minute, respirations of 18, the blood pressure of 122/80, and the temp of 98.4 degrees Fahrenheit. What is this condition called? So I'm going to click back here so you guys can see that. And then I'll give you 5 seconds to answer. So in 5, 4, 3, 2, and 1. The correct answer is A, tachycardia. So a pulse over 100 is considered tachycardia, which may be caused by fever, dehydration, pain, or anxiety, and should be reported. Question 43. Which of the following tasks is within a CNA's role when caring for a patient with a tracheostomy? A, suctioning the airway. B, changing the trach ties. C, replacing the trach tube. Or D, monitoring for changes in breathing or secretions. All right, we will reveal the answer in 3, 2, and 1. The correct answer is 43. To 43 is D. In monitoring for changes in breathing or secretions, the CNAs can observe and report changes but do not perform invasive trach care, because you guys know that is out of the scope of practice. So that was question 43. We'll go to the next one. Excuse me. Question 44. A patient care tech needs to collect a clean catch urine sample. What is the correct step to ensure that the sample is valid? A, collect urine after the patient has started urinating. B, collect the first stream of urine. C, collect urine directly from the catheter. Or D, pour the urine from the bedpan. So we need a clean catch urine sample. I'll reveal the answer in 5 seconds. And 5, 4, 3, 2, and 1. The correct answer is A, collect urine after the patient has started urinating. So midstream urine reduces contamination from bacteria near the urethra. So first we want to let them clear that and then get the midstream. Question 45. A CNA is assisting with the feeding a patient that is on a mechanical soft diet. What food would you expect to see on their tray? A, tea, broth, and crackers. B, mashed potatoes and gravy. C, fried chicken and french fries. Or D, spaghetti and fried fish. I'm not sure if you guys have ever had fish and spaghetti, but it's a thing in Southern Illinois, and we eat fish, we eat spaghetti with a side salad and garlic bread. It is so good. If you haven't tried it, you definitely have to check it out. I'll reveal the answer in 3, 2, and 1. The correct answer is B. Good job. Mashed potatoes and gravy. So, mechanical soft diet includes foods that are easy to chew, easy to swallow, and soft in texture. Question 46. A resident with dementia keeps trying to get out of bed during the night. What is the most appropriate intervention? A. Raise all the side rails. B. Restrain the resident loosely. C. Use a bed alarm and provide a calming bedtime routine. Or D. Give the resident sleeping pills. You guys are answering this one pretty quick. I'll give you about 3 more seconds. In 3, 2, and 1. The correct answer is C. Use a bed alarm and provide a calming bedtime routine. So, non restraint strategies like bed alarms and routines promote safety while respecting the patient's rights. So, we always want to respect the patient's right and promote safety. Question 47. Which of the following oxygen saturation levels requires immediate reporting? A, 98%, B, 94%, C, 91%, or D, 89%? All right, in 3, 2, and 1. The correct answer is D, 89%. So, an SpO2 below 90% is considered hypoxia and is a medical emergency. The nurse should be notified immediately for possible oxygen administration. So, the patient may need supplemental oxygen if it's running that low. Question 48. A CNA is assigned to take vital signs on a patient who just drank hot tea. What is the correct next step? A, take the oral temperature right away. B, wait 15 to 20 minutes before taking oral temperature. C, take a rectal temperature instead. Or D, wait 5 to 10 minutes before taking an oral temperature. All right. I'll give you guys 3 seconds here in 3, 2, and 1. The correct answer is B. Wait 15 to 20 minutes before taking an oral temperature. So, hot or cold fluids can affect oral temperature readings. Waiting ensures accuracy. So, for example, if I'm your patient, you see that I'm drinking water, you will want to wait. And if you see, say, hey, I'll come back in like 15 to 20 minutes to recheck your vital signs. And they'll say, okay. And then also tell them, please don't eat or drink anything while you're waiting, because I want to make sure that you have an accurate temperature. Because some people may think, okay, they're coming back, I can drink again, let them know the reason as to why you're coming back. Question 49. A resident asks if you will read the Bible to them, but you're atheist. What is the most supportive action? A, contact the chaplain. B, call the patient's family and ask if they will read with the patient. C, acknowledge the patient's request and read to the patient. D, tell the patient that you do not believe in God and refuse this task. I think this is kind of a tough one too. Give you guys 5 more seconds to answer that. In 5, 4, 3, 2, and the correct answer is going to be C, you all. So we want to acknowledge the patient's request and read to the patient. So acknowledging their feelings shows compassion and builds trust with the resident. Although religious views may not be the same, it's important to support and assist the patient. So we're not saying that we're converting to what they are, but we are there to support and help our patients. So this may happen. It may have already happened to you before, but what you're doing is supporting the patient. You're not engaging in the religion per se. You're just helping the patient feel supported and reading the Bible to them. All right, question 50. A CNA is assisting a patient who is on strict intake and output. Which of the following will be recorded as output? A, 200 milliliters of juice. B, A was 200 milliliters of emesis. B, 240 milliliters of juice. C, 1 cup of water. Or D, IV fluids administered. So remember what your test question is asking. And I'll give you guys 3 seconds to answer. In 3, 2, and 1. The correct answer is A, 200 milliliters of emesis. So output includes fluid loss such as vomit, urine, or diarrhea. Food and intake items are not output. That would be considered input, and the question was asking for output. Which of the following requires immediate reporting to the nurse during feeding assistance? A, the patient eats slowly. B, the patient refuses dessert. C, the patient asks for extra water. Or D, the patient begins coughing and choking. We'll reveal the answer in 3, 2, and 1. The correct answer is D. The patient begins coughing and choking. So coughing and choking may indicate aspirations, which is a medical emergency. How many questions? We are going to 55 tonight, you guys. Hang tight with me. We are almost done. Question 52. Which statement by a CNA demonstrates an understanding of HIPAA? A, I shared her diagnosis with a roommate to help comfort her. B, I keep my patient notes in the locker at home. C, I only discuss patient information in private with authorized staff. Or D, it's okay to post about my shift online as long as I don't name the patient. All right, we'll reveal the answer in 3, 2, and 1. The correct answer is C. I only discuss patient information in private with authorized staff. So HIPAA requires patient confidentiality and limits information to sharing authorized individuals only. So HIPAA definitely just think about privacy and confidentiality. Question 53. A resident with COPD becomes short of breath while walking to the dining room. What should the CNA do first? Tell the resident to walk faster to finish quickly. B, instruct the resident to hold their breath to control symptoms. C, help the resident sit down and encourage pursed lip breathing. Or D, offer them water and continue walking. All right, we'll reveal the answer in 3, 2, and 1. The correct answer is C, help the resident sit down and encourage pursed lip breathing. So pursed lip breathing helps control shortness of breath. In COPD questions, it's a non-pharmacologic technique that helps airways open and improve oxygenation. So we never want to rush or ignore respiratory distress. So the pursed lip breathing is when they're breathing like that, slow in through their nose, out through their mouth, like that. It helps regulate the breathing. All right, question 54. While completing a bed bath, a resident complains that they are getting cold. What should the CNA do? A. Ensure that the patient remains covered, only exposing the area that's washed. B. Stop the bath. C. Document and notify the nurse. Or D. Turn on the space heater. All right, and 5, 4, 3, 2, and 1. The correct answer is A. Ensure that the patient remains covered, only exposing the area that is being washed. The rationale is ensuring that the patient remains covered, only exposing the area that is being washed promotes warmth, comfort, and also privacy. Question 55. While recording a patient's intake, you realize you forgot to document lunch. What should you do after notifying the nurse? A. Estimate and write down what you think they ate. B. Leave it blank. C. Ask the patient if they remember. Or D. Document the late entry per the facility policy. Give you 5 seconds to answer this in 5, 4, 3, 2, and 1. The correct answer is D. Document late entry per facility policy. So proper documentation includes noting corrections or late entries honestly and according to policy. So again, here you guys we have, let me show you guys the full thing here. You can call our career advisors for more information at 877-225-7151. It's offered nationwide. Also, PCT classes are offered. You guys can go to www.floridacareeracademy.com. And if you haven't done so already, I want to thank you guys for watching. Please go comment, like, share, and subscribe, and follow us at Florida Training and at Eunice Mathis. And I'm thankful that you guys hung out with me. I hope that you guys learned something that you can take along with you. And I hope that everybody passed their test. I know you guys will. I know you guys are very smart, very intelligent. And thank you guys again for tuning in to our Monday Night Live. Hope everybody has a good evening and take care.